cardiopulmonary systems. So you need to know about the bony structures, the soft structures, where they are, how they move, what their function is, what they protect, and what they're made up of. So if I said upper respiratory system, you would be able to tell me what structures are in that. Or if I said in the thoracic cavity, what structures are composed of that, okay? So go back in and take a look at that. We know about the heart. Think back to the pictures of how I drew on the board, or how what a normal heart looks like, how the base is at the top because it's the broad part, and the apex is at the bottom because it's the pointy part, okay? We need to think about how we find those structures. Remember the lab when we were in here poking on me and poking on y'all, and some of y'all were like, oh, I'm really sore from trying to find that sternal notch between the manubrium and the sternum. You need to be able to tell me how to find that, where it is, what's located underneath it, where those auscultatory sites are in regards to those structures, because we know that all the valves are behind the sternum. So like, where do I listen to the mitral valve? And is that S1 or is that S3, or what location those spots are, okay? We need to know about different layers of the heart, different layers of the lungs. So think about those cross-section pictures that we went through. You need to know exactly what is lung, what is heart, what is like around the heart type stuff. You need to know, and I don't know if I can stress this enough, the path of a little blood cell from your big toe all the way through your heart, your lungs, and back out to your big toe. You need to know all the different names for the valves, if they have alternative names, nicknames. Don't just tell me it goes through the atrioventricular valve. That's not going to fly for me. I need you to be a little more specific. If it's a right or a left, or if it also could be called something else type thing, okay? Remember when we talked about pulmonary arteries and veins? They're a little special in their naming. They don't follow the typical artery and vein names. So you need to know where they are, what structure they come from, where they lead to, what kind of blood they carry, oxygenated or deoxygenated. We talked about coronary arteries, kind of briefly, but they're important. They feed a very important muscle for you. You need to know where they come from, where they branch to, what their names are, what part of the heart they cover, that type of thing. You need to know about that funky little thing that was in the book where we talked about like normal breathing patterns, where we have like your normal inhale and exhale and your different levels of like residual volume. You need to know about cardiac output and what your normal volumes are and abnormal are. What's it called when you have the amount of blood being pumped by the heart in 1 minute? Anybody?
1 minute stroke volume.
I didn't hear it in unison, so y'all need to go look that one up again.
1 minute? Oh, cardiac output. Yeah, okay.
You need to go in and look at what your normal vital signs are. We've done all sorts of assignments in labs on different vital signs, how to collect them, how long to collect them, if it's a normal, non-crazy patient, non-involved patient, like how long do you listen to a heart rate? And if they have a known arrhythmia, how long do you listen for that heart rate? How do you take a proper blood pressure? What is a normal blood pressure? What's an abnormal blood pressure? What classification and category do those abnormal blood pressures fall into? Is it hypertension? Is it stage 1, stage 2, like all that kind of stuff you need to be able to know. We talked about electrical system of the heart and how that happens to get the muscle to contract, and how it's separate than this sending those electrical impulses down to make it contract. We talked about different structures of the lungs, how there's an uneven number of lobes and which side has more and which side has less, and why. We talked about where all of the gas exchange is happening in those lungs. I do give you guys some examples of some scenarios to kind of give you like if this was your patient in this situation, then answer this question. So you may need to be able to think critically and clinically about, okay, well, if this patient had this vital sign set, like, what does that tell me and how would I proceed? Like, is that normal? Would they fall into a low risk category? And could I then maybe try something else a little harder with them? What would that harder thing be? Or is that an abnormal response and maybe I need to take it easier on them, and how much easier would be appropriate for them? So some of those clinical judgments we're gonna start working on in here since you haven't had a first clinical rotation. How about patients with pulmonary problems? We did a little bit of exercise this morning with the first lab group talking about some cervical flexor exercises. In your textbook, there's something called jugular venous distension. We didn't really have a chance to go over it in lecture, but there is signs for that you need to review. It's pretty clear in the textbook. Make sure that you look over that and how to assess jugular venous distension. We talked about different kinds of testing with our quick little activity lab, where you did like the 6-minute walk test and the timed up and go test and the stair climbing power test. What do those types of tests tell us? How could we objectively determine improvement for our patient? What types of scales can we use to help correlate and determine if they're effectively and accurately giving us good feedback? So Borg scale goes from what number to what number?
6 to 20.
6 to 20. So if they tell me, oh, that's a 3, they're not using the right scale. They're not using Borg. Okay, so you need to make sure that you explain it. How would you explain that to the patient? And what should you as a clinician know that it correlates with? Okay, you need to know about each one of those tests. There were some that we did that we weren't able, or that we discussed that we weren't actually able to demonstrate, like a claudication test. Obviously, if I tell you to go walk, you're not going to have intermittent claudication because y'all aren't symptomatic. But what would that kind of test be? Not that you did it on each other, but you did like a 6-minute walk test. How would a patient that had claudication respond to that type of test? How would you monitor them? How would you instruct them to continue with that testing? Okay. How about this test? Does anybody remember what this one's called?
Shimlock. Not Shimlock. Shamrock.
Shamroth's test.
Yeah.
And what does it tell us?
Clubbing.
It's for clubbing. And what is clubbing a sign of? There you go. How about edema? We talked about different kinds of edema, where we've got like just the normal puffy, boggy type of joint effusion edema, and then we talked about like pitting edema and how we would measure that, how long it lasts based on how deep it is and how quickly it takes to refill, and what kind of grading scale we utilize for that. You need to be familiar with it. You need to be able to grade something. If I tell you I indented it, it was this deep and it took this long to refill, what's the objective number that you would put in your note? You know, was it a 1+, was it a 4+, that type of thing. What are appropriate responses to exercise and inappropriate responses to exercises? There were like a couple of pages in your books. You just have to memorize them. I'm really sorry. There's not a nicer way to say it. You just have to know all of them because they're all important. So if somebody has shortness of breath, is that an absolute let's stop treatment, or is it a let's rest, take some precaution, and then like see what their oxygenation is and maybe continue? Okay. How about like heart rate? Does their heart rate respond appropriately? And if not, how long do we let them rest? And if it doesn't come down, what do we do? That type of thing.